Bismillahirrahmanirrahim. So we are going to discuss about the refractive surgery options. First of all, corneal based excimer laser. Um, the categories in which the excimer laser is used involves photorefractive keratectomy, LASIK, LASIK, SMILE. So PRK is photorefractive keratectomy in which epithelium is removed, stroma is selectively ablated with the excimer laser, and then BCL applied. So approximate refractive error that is corrected by this technique is +6 diopter spherical to -12 dioptric sphere. So this is the range, and up to 5 diopter cylindrical number can also be improved by this technique. Second one is the LASIK. So this is the laser assisted epithelial keratectomy. This is a surface ablation technique like the PRK. Epithelium is removed as sheet using the alcohol. Then stroma is selectively ablated with excimer laser. Epithelial sheet is replaced and then BCL inserted. Same refractive error correction. Then there is epithelial laser in situ keratomyelitis, EPILASIK, in which surface ablation technique is used. Epithelium is removed as sheet mechanically with epikeratome. Then stroma is selectively ablated with the excimer laser and BCL inserted. Here epithelium is mechanically removed with epikeratome, and in LASIK the epithelium is removed as a sheet using the alcohol, whereas in PRK epithelium is removed, no specification. So in same refractive error correction, then LASIK, LASIK, laser assisted in situ keratomyelitis, in which flap based technique is used. Partial thickness superficial corneal flap is created with microkeratome or FSL. Stroma is selectively ablated with the excimer laser. Flap is replaced. Then SMILE, small incision lenticule extraction, in which the femtosecond laser technique is used. Single step where a lenticule of the tissue is removed through a small incision with no flap. -1 diopter spherical to -10 diopter sphere, and 5 diopter cylindrical number can be corrected through it. Then incisional surgery involve the radial keratotomy, arcuate keratotomy, limbal relaxing incisions. These are the incisional surgeries. Radial keratotomy, peripheral deep corneal incisions cause central corneal flattening. Myopia up to -6 diopter sphere can be corrected. Arcuate keratotomy involves the paired arcuate corneal incisions in the mid-periphery, causing flattening in that meridian and steepening in the opposite meridian. Astigmatism up to 6 diopter cylindrical can be improved. Then limbal relaxing incision, LRI, paired arcuate incision at the limbus. In arcuate, there was paired arcuate corneal incision in the mid-peripheral cornea. But in the limbal relaxing incision, it is given at the limbus, causing flattening in that meridian and steepening in the opposite meridian. Astigmatism up to 3 diopter cylindrical can be corrected. Then corneal shrinkage surgeries, in which we have the laser thermal keratoplasty, LTK, conductive keratoplasty, CK. So laser thermal keratoplasty involves shrinkage of the peripheral corneal stroma in a radial pattern, causing flattening and corresponding steepening of the central cornea using holmium and YAG laser. Low hypermetropia and presbyopia up to 3 diopter sphere. Conductive keratoplasty involves shrinkage of the peripheral corneal stroma in a radial pattern, causing flattening and corresponding steepening of the central cornea using high radio frequency currents. Here we use the high radio frequency currents. Low hypermetropia up to 3 diopter. Then corneal additive surgeries like the intracorneal ring segments (ICRS). Plastic ring segments are placed inside the preformed tunnel in the peripheral cornea, causing central flattening. So low myopia up to 3 minus diopter, astigmatism in keratoconus is corrected through it. And lens paste involve the phakic intraocular lens and crystalline lens intact. Synthetic IOL is placed in the AC. Iris fixated toward the angle supported or in the posterior chamber (-5 diopter to -20 diopter). Then refractive lens exchange RLE. The crystalline lens removed and replaced with the PCIOL, posterior chamber in IOL, monofocal, multifocal, or the accommodative. Any refractive error can be corrected through it.